Well, my name is Ben Smith. I'm an Associate Professor in the School of Public Health and Preventive Medicine. I'm the Head of the Behavioural Science and Prevention Unit, which is within the Division of Clinical Epidemiology within the school. I started at Monash in 2007 when I began here as a senior lecturer. So in regard to the research that I've been involved at here at Monash, it's largely been focused on looking at the effectiveness of different strategies to tackle chronic diseases. And in my case, particularly on the effectiveness of strategies to promote physical activity for the prevention of chronic disease. So we've got very strong evidence that physical activity participation, it reduces the risk of heart disease, stroke, diabetes, it can reduce the risk of dementia, and it can improve mental well-being as well. Yet less than half of the population, we know from a range of different population surveys, participate in the recommended amounts of physical activity. So we're looking for effective strategies to address this challenge. Just to give you a taste of a couple of the studies that I'm involved in at the moment. One is the RESET study, which is investigating the feasibility and impact of using smartphones, particularly SMS and web-based delivery and videos, as ways of promoting lifestyle change along with adherence to medications by middle-aged people who have high blood pressure. And that's funded by the National Heart Foundation. Another project that I'm involved with at the moment is called the Move Frankston study. And what this is looking at is the effectiveness of introducing large multi-million-dollar multi-purpose recreation facilities into communities. We see a lot of these leisure and recreation centres popping up all around Victoria and the country, but there's been no research about what kind of impact they have. So we're following a cohort of people to see how many of those people start to use the facility, and also including a couple of arms where we're introducing some different types of social marketing strategies to see what sort of effects these have on promoting attendance at the facility. Career highlights in my research career have been, I think, where I've seen the research that I've been involved in immediately have some kind of bearing onto practice and policy. So I think of a few clear examples here. During my PhD studies and in subsequent studies after that, I was involved in looking at the different kinds of strategies that general practitioners could use to promote physical activity to their patients. So we trialled a physical activity prescription as a minimal intervention, and that was subsequently picked up and rolled out by the National Heart Foundation.